All right, welcome everyone. First I'll introduce Karina, who's our prosthetist for the video, and our patient over there on the bed, Ian. So firstly, what we'll explain is our RID kits. So Karina, what we essentially have is pre-made kits of everything we need during the fabrication process. So behind Karina there, she'll show you some examples of, so for instance, that's a kit made up in a bag, and we also have replacement kits if someone needs a replacement RID later on, as well as spare sock packs and that type of thing that we already have pre-made to save doing that in an emergency situation. So on the table here at the front we have what's inside our standard RID kit all laid out on the bag. So for instance we have the stump sock, some padding, a purlin sock, an outer stockinette, as well as a cuff, a Velcro strap, a couple of freezer bags, and they're not in the kits itself but always in our bags. We have a pair of scissors and some gloves there, a permanent marker, as well as a spray water bottle and some micropore tape, which you'll all see what they all do individually in a minute. Okay, so our next thing to explain is patient positioning. So obviously normally we fit these in recovery and the patient will be on a hospital bed, often normally out of it and not able to assist you. So the bed will often look something similar to this one. So probably our first thing that we would do is raise up the bed to a suitable height at waist level. And then we'd raise the cot side on the stump side, we'd lower the cot side, and we also have a wedge pillow that either most of the hospital recoveries will have, but we normally take our own to save the hassle of finding theirs. So we'd put that underneath their thigh. From here is probably about when Karina would ask a nurse, or if we've got a student at the time, to come and give assistance from here. So we'll bring Melita into the video and we'll commence our fabrication. So as Dave said in his presentation, we have a pre-printed fabrication procedure. So it's a step-by-step process, so we don't forget anything. So the first thing we do is wash our hands, which the girls have done already, and put some gloves on. A handy trick is actually putting a second pair of gloves on as well, just so you can remove one as the fiberglass of the ShapeMate sticks, which you'll see them remove a bit later on. So obviously, Ian here had his amputation about 10 weeks ago, and his wound is healed and that type of thing. So normally at this stage there'd be some dressings on the wound, possibly a drain tube and a nerve block and that type of thing in there. But obviously we don't have that at this situation, so use your imagination. So the first thing that we would do is apply the stump sock, is the next step. So this often requires two people just to give it a two-way stretch to get it on over the top. Very good. Yep, so they're making sure they get as many of those wrinkles out and the rabbit ears at the bottom of the sock as much as possible. Our next step is to add relief padding. So normally we would do this over the suture line, along the tibial crest and the patella area. So this relief padding doesn't actually stay inside the RID, it just creates a space inside it. So sort of like a plaster model build up. And then stick that down with the micropore tape. All right, step number 4 is to cover that with a freezer bag. So this freezer bag just creates a barrier so the next step, the purlin stocking, doesn't stick to the actual stump stock. So yes, that leads me to step 5, apply the inner purlin stocking. And then from there, we often tape it over the thigh just to stop the stocking from sliding down. This is required more depending on the shape of the stump. Alright, so from there we would then mark the trim line. So normally we were around mid-patella anteriorly down to just below the popliteal crease posteriorly. Okay, so our next step is to check and open the shape mate. So we often check these first and give them a squeeze. Sometimes if they've been sitting on a shelf for too long, they will set in the bag and go hard, but if they feel nice and soft, then they're normally good to use. So from there we'll open up that shape mate. And as we've said, this is the current style of shape mate that we've been using over the last probably 2 to 3 years. So you can see it comes pre-folded, and Karina's having to unfold that completely. Depending on the stump shape, sometimes you can, if it's too long, so you can leave the final third folded up. But depending on how big the stump is, if it's a bigger one, you might have to unfold the whole thing. And as you can see there, she's rolling that down in 1 centimetre-ish sized folds. Also doing this, avoiding best as possible to get any creases and that type of thing in the shape mate itself. And you'll notice she hasn't actually sprayed her gloves with water or anything, so at this stage that helps to prevent it from sticking. We used to spray our gloves with water with the old shape mate to stop it from sticking, but we found that with this newer shape mate, keeping your gloves dry at this stage is easier. Okay, so once she gets that flat at the end, you can see she's giving that a good stretch in both directions. And then from here she calls in her volunteer. So Karina herself is stretching in the ML, and Melita will stretch it on the AP to get it over the end. And then from there, they're just rolling that up onto the limb. So when we're rolling this up, what we would normally do is aim to get it about 50 mil above those marked trim lines, and then once you get up there, cutting any of the excess off. So this is definitely one of the challenging parts when we're doing these in recovery, as the patient is unable to lift their leg to help you out the majority of the time. So if you're doing a replacement one of these, or if you aren't able to do these in recovery and you're doing them, 1 or 2 days post-op, then positioning-wise it will be easier for you because the patient can normally hold their leg out and assist you. All right, so now that that's cut, they're rolling or folding back the top of the shape mate to the marked trim line areas. We've now done. All right, and then from here, I'll grab the spray bottle and a second freezer bag and spray inside the freezer bag as well as onto the shape mate itself. So just this little bit of moisture and enclosing it just helps it to set that little bit quicker. And then so from here, depending on the patient, if Ian was asleep, he wouldn't be able to be holding his leg out straight like he nicely is at the moment. So you may need to be standing there and holding up the distal end while that is setting. So Ian, if you could just relax your leg. So sometimes it just goes to that position and that's okay. So normally this takes sort of 5 to 10 minutes to set enough. Okay, so the next thing that I'm going to show you, or Karina and Melita are going to show you, is the variation of the shape mate that is hopefully soon to be released. So as Dave said in his presentation, this is a shape mate that comes pre-rolled instead of folded. So everything else is the same with the setup and everything up until rolling on the shape mate. So Karina's opened that. These come in a few different sizes as well. So this one that we've chosen for this one is a 4-inch circumference size. This one has particularly sticky Glad wrap. Okay, so basically with this we have 1 less or 2 less steps of having to firstly unfold it and then roll it up ourselves as it comes pre-rolled. And you may or may not be able to tell that it also seems to be a lot stretchier as well, so we should have far less issues ongoingly with the bigger stump sizes. Okay, so Karina's given that a good stretch by herself first. And then rolling this on just like before. So I didn't mention on the first one, but with patients in pain, it's normally just those first couple of centimetres and the initial contact that may cause them some pain, and then normally from here it's a big relief and they're not in too much pain from this part. So the girls are cheating again and having the patient help them. So often you might have to temporarily move the wedge pillow out of the way or just slide it right up as high as possible onto the thigh to be able to roll it up far enough. And then even from here is the same as the other one, just cutting off all the excess. And rolling it down to the trim lines. All right, and then spray and put the bag on, same as the other one, and has roughly the same set time is the other one too. I think we've sort of noticed it might be an extra couple of minutes to set compared to the other one, but as I think it uses a slightly thicker sock, so it often, eventually once it sets, it often is even that little bit harder than the other one. Okay, so it's now been that 5 to 10 minutes, and so in that time the ShapeMate sets off an exothermic reaction, so it starts to go warm first, and then it'll obviously start cooling down a bit after that. So the time to remove the ShapeMate is fairly important. Obviously don't want to remove it too early while it's still too soft and unset, because then it'll obviously lose all its shape. But in contrast, you don't want to leave it on too late, especially if they're really bulbous, because if you do, it'll be set so much that you won't actually be able to get it off, or not easily without having to cut it while it's on the patient. So what Karina would normally do at this time is just tap it in a few areas just to feel if it's gone hard enough in certain places. And so I believe at the moment it's probably set just the perfect amount. So from here she'll undo the tape at the top. And then pull down on that stocking to slide the whole thing off. Alright, so then from here we've got to remove that padding that we put on first, cut off with those scissors the excess Perlon stocking, and then also make the decision from here as to whether or not the RRD needs a split in one side or not. So I'd say for us, probably 9 times out of 10, the ones we're doing in recovery do need one due to the bulbous shape of the stump. I'd say Ian's shape now is probably borderline, but for the sake of doing the video, we'll put a split in this one. So the majority of time this split will be on the medial side, mostly due to that being the more bulbous, or where the medial gastrocs are is normally the more bulbous area of the stump. So it makes more sense to have the opening on that side. Alright, so we'll use that split to slide it on. And then with these pre-made bits of Velcro, putting that on to close that split. Alright, so our next step is grabbing our permanent marker and drawing all over the RRD. So our standard things are we'll mark where the Velcro strap is, and sometimes write the word strap on that as well as marking where the patella is anteriorly. So we do all these markings just because we often go back and review them days or in our ongoing reviews, and things can be put on backwards and upside down and everything else. So Karina's then writing front in that patella area as well, just like so. Okay, then after that we pull on the outer stocking as well. And then putting on the cuff above the knee as well. And on this cuff we would routinely write something like above knee cuff, outside stocking. really try to spell it out as well as we can, because again we'll often come back a couple of days later and this will be on instead of the Velcro strap closing the split, and all kinds of things that can go wrong often do. And then we'll just fold that stocking over the cuff, so that cuff's just to stop the whole thing from sliding off. And that's essentially it. So from there we will, in recovery, we'll take out the triangle wedge as Karina's just done, and then we'll normally grab another pillow. Here's one we didn't prepare earlier. And we'll just put that underneath the patient's leg for two reasons: just to help keep the stump elevated, to further help reduce any ongoing swelling, as well as it also helps to maintain the knee in extension to prevent any contracture as well. And from there we would then pull the cot side back up to prevent him from rolling out of the bed, and go and write in our notes and then come back and review it in a day's time.